All right. Hey, everyone. I just want to say welcome to our CHT tonight with Dr. Breus. I'm sure all of you guys know who he is. He's the sleep doctor that we all see on Dr. Oz and Good Morning America and all the fun things. And at Valley Sleep Center, we were blessed to have him as one of our consulting physicians for a while. So had a lot of fun with you, Dr. Breus. I told you I had a sleep study last night.
Yep.
And I got up at 3:30 to go to the bathroom because, I'm a grandma and that's what we do. And I could not go back to sleep. And
Oh,
talk about cool your racing mind. Why does our mind race like this? So I'm just really excited that everyone's joining. We're going to be talking about the Ebb device
yep.
that you're so familiar with.
I've got mine right here.
Yeah. So I can't wait to hear what you say. And one of you in the attendee list is going to win a free, what is it? $349 value.
Oh yeah.
Yeah. So awesome. Look at that. 64 participants. Welcome everybody.
Yay.
If you have any questions, feel free to put them in the chat.
Yeah.
And when Dr. Breus is done, we'll just casually, you guys are a webinar. You can see us. Your questions are anonymous. So just feel free to throw them out there and give us some encouragement along the way. And Dr. Breus, it's all you. Thank you so much.
No, it's absolutely my pleasure. Thank you, Lori. So Lori's being kind. Lori was my boss for quite a while. She's amazing. We had a lot of fun working together and I drove her a little crazy and now she really loves me. So it's great because, that's how I am.
We did a dinner last night with Respicardia and Andrew was there. And
I love it.
Yeah, I know. He's like, I miss Dr. Breus. He was the best. Yeah. Yeah. We miss you. We definitely miss you.
You're super kind. I'm very excited to be back here. Plus, it's just fun to hang out with people from Valley Sleep again. So for folks out there who don't know, I worked at Valley Sleep for quite a while. Really enjoy it. The highest quality sleep medicine I've ever worked in, just to be super duper clear. So you're going to a right place and you're definitely in the right spot now. But we're not here to talk about that. We're here to talk about crazy racing thoughts before bed and what does that mean and why do people have them and things like that. Yes, I was in Scottsdale. I lived in Scottsdale for a while and I saw patients at the Mesa Clinic, the Scottsdale Clinic, the Surprise?
Glendale.
Glendale.
Yeah, Glendale. Yeah.
Yep. So I was at all of them.
You were all of them. I think you spent a day a week. Didn't you go to all 5?
I think there were definitely weeks where I did.
we have almost 7 now.
That's amazing.
Yeah.
That's so cool.
Yeah. That's cool. Yeah.
That's so cool.
All
right. So getting back to our topic. So here's what's interesting is when you think about insomnia, right? And you think about, gosh, I can't fall asleep or I can't stay asleep. Those are 2 different kinds of insomnia, but actually they have very similar symptoms. One of the most similar symptoms in both cases is people cannot turn off their brain, okay? And that's the number one thing I hear in my office constantly is, Dr. Breus, how do I turn off my brain? I can't do it. It's driving me crazy. And here's the thing, it kind of makes sense, okay? So let's just think about it for a second. What is the one time of day when nobody out there is asking you for anything, when nobody out there is tugging at you and asking you to do things? It's when you're about to fall asleep. And that's when all the thoughts will come flying in of all the different things that you did during the week. So it makes perfect sense for you to have a lot of thoughts going on right before bed. That because you haven't really given yourself time to do that anywhere else. And so one of the very first things I talk about with people is what's called a worry journal, right? And so what does that mean, a worry journal? That sounds all clinical, Michael. What are you talking about here? It's a piece of paper. Take a piece of paper, draw a line down the middle, right? Put everything that's bothering you on one side, and then one solution or one step towards a solution on the other side. So if the problem is Johnny's not doing well in school, maybe the solution is tomorrow, take 15 minutes at 2 o'clock to call Johnny's teacher. Doesn't mean you solve the problem, but it does mean you have a step in the right direction, which helps lower your stress. right? But let's say that you've tried worry journals or journaling, or let's say you're in therapy, but you're still having a lot of these intrusive thoughts just before bed. So I was very fortunate about, oh gosh, 4.5 years ago or so, I met Dr. Eric Knopfsinger. Dr. Knopfsinger is really a legend in the sleep research world. A lot of people outside the sleep research world might not know of his legendary status, but inside sleep research, he's really quite amazing because his research is so pristine. His research really understands new and different areas and has taught those of us in sleep medicine tremendous amounts. So it's kind of interesting. But here's how it all started. He was an ER doc, believe it or not. And if any of you, hopefully none of you have had this happen, but if any of you have wandered into the ER with a cracked open head, the very first thing that they do is they wrap your head in ice. Now you might be wondering why on earth would they do that? It's called the neuroprotective effect of cool or cold. So what happens is when you circulate the skull with ice, everything slows down. Blood flow slows down. Now, when we know this in the ER, but that doesn't help you when you're trying to fall asleep too much, right? Well, Dr. Knopfsinger knew about this neuroprotective effect of cold from working in the ER. Later on, he actually did studies in what it's called neuroimaging. So he liked to take pictures of the inside of people's heads, doing MRIs and fMRIs and all these kind of crazy things. And he discovered a way to do this while an insomniac was trying to fall asleep. It's technical, there's a lot to it, but trust me on this one, he figured it out. And I was pretty amazed when I really walked through all the science of it. He figured out a way to look at different flow patterns in the brain just before somebody was falling asleep. And here's what he discovered. For insomniacs, for people who had this whole thing going on where they couldn't turn off their brain, again, that's their number one complaint. Here's what he discovered was this frontal area had tremendous blood flow. Lots and lots of stuff going on in these people, not so much in other people, but in people who reported, hey, I can't turn off my brain. So he remembered the neuroprotective effect of cold from his ER days. And he said, I wonder what would happen if I just stuck their head in the freezer type of thing, right? Now, to be clear, he didn't say, I want to stick their head in the freezer. What he did say was, I wonder if there's a way that I could actually do something that could circle the skull and actually cool the skull down. So he came up with this thing. And to be honest with you, it was kind of big, right? It looked like this crown that went all the way around your head. It was kind of thick, had this long hose, and it went to this thing that went on the side of your bed. So I got one of them because I figured I might as well give it a shot. And I'll be honest with you, it was a little bulky, and it didn't, for me, didn't work as well as I thought it could have. And literally 4 months later, the company called me up and said, Michael, you got to check out this Ebb Versa Cool Drift. And I was like, I tried the Ebb. It was kind of big. It was kind of bulky. It was hard for me to use. They're like, Michael, this is the travel version. You could use this anywhere. You travel all the time. We'd love for you to get your head around it. Literally. That was my best joke. I'm just saying, my best one. Just threw it out there at you guys. So here is the Ebb Versa Cool Drift. Now, I'll tell you, there's a lot of things about this thing that I like, but my favorite thing is telling the story of the first night that I used it, right? So here's what's interesting about it is, here it is. Okay, so it looks a little goofy. I'm just going to say it does look a little goofy, but the performance of it is well worth the goofiness. So you put it right here just like this, okay? And it goes across the forehead. Now, here's what's interesting about it. You have a handheld control, right? And it's wired. It's not wireless. Now, the first thing you're going to people say is, does anybody get tangled up in the wire? Are you afraid it's going to? I've slept with this thing for months at a time, okay? I've never even had an issue of it draping across my neck, much less doing something like that. This is a removable little piece of Velcro, and you can actually attach it to the head strap. And once you click it on by just pushing the button, goes up, you're ready to go, and then it starts to cool itself. Now, here's what's so fascinating. So somebody said to me, well, Michael, what was your experience with it? So look, I put it on and I laid down. My wife was walking by. She took one look at me. She said, you look ridiculous, okay? I was like, I'm trying out this new piece of equipment. give me a break. This is how we are, right? I mean, I'm always trying something interesting, something new. I closed my eyes, and when I opened my eyes, it was morning. I was still in my clothes. I hadn't moved a muscle. Okay. I was like, all right, that's never happened to me before. So I took it off, got dressed for the day, and I decided I wasn't going to use it the next night to see if maybe I was just super tired, what was going on, my normal kind of sleep. Tried it again the third night, exact same thing happened. I literally put it on, closed my eyes, and I woke up the next day. And my wife wanted to try it, and I told her to go buy her own. I'm telling you something, this thing is amazing. And I mean, I was really quite surprised at how effective it was. Now, there's a couple things about it that you'd have to get used to. So number one, there's a slight hum that seems to go on during the cooling process, okay? I liked it because I like white noise. The white noise is something that kind of is soothing to me. And so there is a bit of a hum. I mean, if you think about it, you've got like a mild, small refrigeration unit that's going across your forehead. There's going to be some type of a sound that's going on there. Another thing people often said was, well, is it too cold? Like, do you shiver? Does your body get cold? Oddly enough, that doesn't seem to happen. It appears to go into a range of temperature. Now, this remote, you can use it to make it a little bit warmer or a little bit cooler. You're never going to make it to the point where you can do any damage to yourself, because remember, this is the neuroprotective effect of cold. So you can't hurt yourself by doing this. Now, I did have my son, who thinks he's the smartest person in the universe. He did turn to me when he saw me and I was talking about it. He said, well, Dad, I can take a water bottle, stick it into the freezer, and I can just, put it on my ball cap, and I can do the same thing. Why would I need something like this? So number one, I thought that was a rather intelligent question because I wasn't expecting it at all. But number two, here's the thing that's interesting is it has to be a constant temperature. It has to be a very particular range, and it changes over the course of the night. Because remember, everyone, we all have a circadian rhythm, which follows our core body temperature rhythm. So the way sleep works is we start out with our core body temperature climbing until about 10:30 at night. Then it hits that peak, and then it begins to fall. That falling of the core body temperature is a signal to the brain to release melatonin. One of the other things that's so cool about this is this could be possibly helping engage that mechanism for somebody whose autonomic arousal is so raised up, right? I'm worried, what's going on? My heart's beating faster. Your temperature ain't going down. Your temperature is going up, right? This, I call it the head chiller. I know that's not the official name, but that's what I call it. This thing slows your thinking down, but it also cools you off. And that cooling effect appears to also help people be able to fall asleep. Now, it's not just my opinion that this thing works. As I said before, Dr. Knopfinger's science is really quite spectacular. This is all published literature. This is in some of the highest, most well-respected journals in the country. So this is really a very unique piece of technology with some great, great science backing it up. So I've been pretty impressed. They just came out with this new study also I wanted to mention where they used this one in particular for menopausal women. And they found it was extremely helpful for hot flashes and for helping them sleep through the night. I mean, come on, menopausal women. Are you kidding me? It's like impossible to get them to sleep. So I know, right? So it's like, this is really cool. That was my next best pun. This is really cool technology. Like, I think it's pretty awesome. So with that, I know I've been chit-chatting away. I'll open it up to questions, and Lori, you're probably going to kill me by now.
Do you think that people could wear this with CPAP?
Yeah, I do think they could wear it with CPAP. But one thing to remember for a lot of people is, for some people, what they can do is they don't have to wear it all night long. Some people will wear it, and as they start to feel drowsy, they can just remove it and put it to the side. So if, for example, you had a full face mask on, right, and then you had one of these on, and then you have the hose, it could get a little crazy. So you could wear this while wearing your CPAP and then just pull it off and be able to fall asleep. I don't think that would be a problem.
Awesome. Let's see here. Someone asked, is racing thoughts before bed always anxiety?
So to be honest with it, it usually is. I would say 75 to 80% of the time. But when we talk about anxiety, sometimes we have an idea in our head of what anxiety is, the person who can't sit still. That's not always what anxiety is, right? Anxiety comes in many, many forms. You can worry about things, and that could be anxiety. You could have health-related concerns. That could be an anxiety. By the way, we're in arguably the most anxious times of our lives. There's this thing called a pandemic that's going on outside my door. And let me tell you something, it provokes my anxiety. So I'm sure it provokes other people's as well. So unfortunately, yes, we do see a preponderance of sleep-related difficulties that are due to anxiety, for sure.
And you're in LA. You guys are back on mask mandate, right?
Oh, it's unbelievable here. It's like,
Yeah.
it's so stupid. Like last week, I didn't need a mask to go anywhere. Now I have to wear a mask when I enter a restaurant. When I walk to my table, I can remove it to eat, but if I need to go to the bathroom and I get up without a mask, I'm screwed. I mean, what are you gonna do?
Hey, can you use this Versa device on children?
Yes, absolutely. So it is safe to use on children. But to be honest with you, if you have a child that turns to you and tells you that they have a lot of racing thoughts, I think it would be important to speak with a healthcare provider or a counselor about what's going on with them. While I don't believe this is designed for anybody 18 years or younger. What I would say is I don't see any way that it could hurt someone. But again, if you have a child who's telling you they can't turn off their brain before bed, that's better off handled more than likely with therapy, with maybe a therapist, a psychologist, a social worker, or somebody like that.
Teach them young, right?
Absolutely.
Teach them young. Okay, let's see here. Yes, I'm recording this, so there'll be a link for all of you guys if you want to rewatch it. I dropped a link in there to Valley Sleep Therapy if you want to buy a device. Again, we're going to be giving one away for a lucky attendee. Is the main purpose of the device to facilitate getting you to sleep, or does it help you fall asleep? My issue is not falling asleep, but staying asleep. Oh, okay. So
Understood.
great question. I'm sorry I didn't word that correctly,
No,
but
no,
great question.
I think I understand what she's asking. So this is primarily for people who have a hard time falling asleep. Or I have had one patient who, when she woke up in the middle of the night, she couldn't return to sleep because she started having these repetitive thoughts. So we kept this on the bedside for her to utilize in the middle of the night. She didn't use it in the beginning, but she would get up in the middle of the night, maybe have to use the restroom, and then whoosh, the brain would just start going. And so that's when she would use this. And so you can use it with either, but initially it was used for falling asleep, but I've seen it used in both ways quite effectively.
So do you recommend waking with the usual alarm clock? Does that still work?
Yep, absolutely. There should be no issues about something like that at all. Also, they have a counseling center that comes with the EB.
Oh, right.
So they have it's a live talk therapy. They've got people there that you can speak to that can give you sleep guidance and give you some not just your normal old sleep hygiene tips, but like really have some thoughtful things to say, have been well trained, like they really know what they're talking about there.
How heavy is it? Like how much does it weigh,
That's a
do you
good
think?
question. I probably have that on a sheet somewhere. I think it's less than a pound.
And then while you're looking at our typical time frame, is there like a minimum or maximum amount that you recommend people use it?
Yeah, I would say 20 to 30 minutes before bedtime kind of sort of will calm your racing thoughts. Some people will do it, by the way, just like relaxing on the couch and then remove it and go to bed. Some people will keep it on their nightstand. And some people leave it on all night long. Me personally, I leave it on all night long. But that's just me. I didn't have any problems with it. The battery recharge, it's got a minimum of 8 hours for a full charge. So it can go for 8 hours. I'm not seeing what the weight is on this.
It's pretty light. I mean, I'm trying to describe like.
I want to say it's maybe a half a pound. Like
like unit. 8 ounces. Yeah.
Yeah, because there's like 16 ounces in a pound, so maybe 8 ounces. The real weight is in the battery unit, which doesn't sit on your head. The real weight is in here. This is much lighter, so I'd say half a pound probably. But we can get back to you on that for sure.
Can we use it during a nap? Would you recommend it for like a power nap?
Oh yeah, I do a power nap with it. It's awesome.
Yeah. Do you have to sleep on your back? What with this device?
No, you can sleep on your side, but it is a little bit more uncomfortable. That's why napping is good because you can kind of practice sleeping on your back while doing it, and it seems to work well. Remember, sleeping on your back is arguably the best position to sleep in, simply because it helps to displace the weight across the musculoskeletal frame that way.
How about melatonin? Can we still use that with it?
Yeah, so it won't affect, it won't have any real effect on melatonin or your own melatonin production. What's interesting is most people, by the way, are taking too much melatonin. The appropriate dose is somewhere between 0.5 and 1.5 milligrams. So if people are out there taking melatonin, you want to make sure you've got the right dosage, but this would work well with, if you're already using melatonin and it's working for you, this would be something you could definitely add to help out.
What's the difference between using this device or just having a fan blow in your face?
Yeah, so this keeps a very consistent temperature, and that temperature is very specific to helping with this slowing down of the blood flow. So it's like my son asked with the water bottle slapping it to your head idea.
Yeah.
You have to be able to get to a very cold temperature. It has to maintain it, and then it has to follow a very particular pattern in order for it to actually be effective. That's why you use it for 20 or 30 minutes.
Is it helpful for people with fibromyalgia?
So I don't know if it's helpful for pain situations, but what I do know is that people with fibro have a lot of chatter going on in their heads. And so I would say that I've never seen it actually studied in a fibro group. Don't quote me on that because I'm not positive. But I think I mean, if I had to take a guess, I would say give it a shot. Because people with fibro have got so many different things going on. If this helps quiet down your brain a little bit, I think that would be welcome.
How do you clean it?
Oh,
what type of material is it?
Yeah, so it's just you take a little alcohol pad, like the kind you'd see at the doctor's office, they rub on you before you have a shot or whatever. I mean, you can get them at CVS. And then there's these little things right here. So you just wipe it across, wipe it here, wipe it here, wipe it there, and it'll just take off the natural oils on your skin. You can see I've used this one quite a bit, and it has had almost no wear to it.
Nice.
This is my personal one. You should see I get some pretty crazy looks on the airplane if I pull this thing out. But honestly, like if I'm on a flight to Europe, like I'm out.
I'm wearing it. Yeah.
Awesome.
What about for like restless leg or people with nerve pain? Like, do you have any suggestions?
I haven't seen any data about this on nerve pain. But what I would say to people, if they are having issues with restless legs or things like that, the very first thing I do is I run an iron profile because I want to know about something called your ferritin. So when people have low ferritin, it can feel like neuropathy and restless legs. So you may want to ask your doctor for a blood test to look at ferritin. I would also look at your magnesium levels because that can also be affected as well. And so for some of my patients, we use magnesium in the evenings. And they have a little bit of iron, and that seems to help them. Especially women have a tendency to have iron poor blood or what's called anemia. So that can have an effect there as well.
A couple of people have commented that their brain sings songs to them every night, or there's like how do I calm the concert? What would you say as your insomnia specialist?
Yeah,
enjoy it.
Yeah, well, I mean, it depends, right? And so like this is a device that's literally designed to help do something like that, right? Is to help calm down that kind of concert in your brain. As a matter of fact, I recently learned, interestingly enough, that over 20 Olympians are using this in the Olympic Village actually right now. So while the US is participating, there's over 20 Olympians who are using this to calm their brains before they go to their competition. So one of the things that I've thought is like this would be great for athletes to try before they get out there because it calms their brain down, allows them to focus, and allows them to move forward. So there's a lot of utility in looking at this in a whole host of different situations.
So, and unfortunately, it is not covered by insurance. But if you have an HSA, an FSA, or HRA, like a card where you can purchase medical type things, you can use it for that. But we cannot order it for you and then your insurance cover it. So it's basically cash pay or use your HSA card.
Yeah, I think the HSA is probably the best way to go about doing that. We have a question from Lisa. She's asking about cancer treatment and melatonin. So I'm happy to answer that. So what's interesting about cancer is cancer has a circadian rhythm to it. Most people don't know that, but you can actually have your chemotherapy delivered on a particular schedule, and it can make it more effective and use less chemo in doing that. And so part of the reason that melatonin appears on so many of those protocols is because they're trying to take advantage of that effect, right? And trying to get people circadian rhythms to be able to click in and work with that. So I understand and can appreciate your question in that it is definitely a supplement that's on a lot of people's minds, especially when it comes to treating cancer. I would suggest that you also look into the literature about the timing of chemotherapy, because that could be advantageous as well.
Is it safe to wear this device to fall asleep when you have a current fever or a high temperature?
So great question. I would not do that. I would, especially during COVID, I would talk with your doctor if you've got a high temperature or fever for sure.
Let's see here. If you fall asleep and you don't take the device off, is that okay?
Yep, I do it all the time.
All right. And I think we answered the nap question. Yes, use it during nap. Great idea.
Oh, Mark Anderson asks, it seems like you might become addicted to this and not be able to sleep without it. So here's the truth, man. There are worse addictions to have, just to be clear, but that's not really how it works. Everybody has the physical ability to sleep. Nobody's got a broken sleeper switch in their brain. Just sometimes it's a little harder for some of us who've got a little bit more anxiety, and this seems to be something that helps us. Can you sleep without it once you've slept with it? Of course you can. It's not like this is something that you would really have to worry about. This is an aid or a tool that can help you, but you're the person who's really being able to fall asleep on their own, I promise.
All right. Anything else that you'd like to add? I think I'll draw the winner. I have this cool little program that's just going to pick a random person. Anything else you want to say while I'm drawing this name?
Well, what I would tell everyone out there is, number one, insomnia or difficulty falling asleep or staying asleep is not a curse. It's not something that you have to live with forever. There are definitely treatments out there. Yes, there are some people who take sleeping pills, and that is okay for some people. It's not the right message for everyone, but there definitely are some people that may need a pill to sleep, and that's okay. Remember, this is one of the most stressful times any of us have ever had in our lives. We're worried about new and different things that we never would have worried about before. So I want people to know and understand that, number one, it makes sense if you're having a hard time sleeping right now. My gosh, my phone is ringing off the hook and has been for 2 years, literally, because of COVID, right?
Right.
So number one, don't beat yourself up for having a difficult time sleeping, because everybody's having a difficult time sleeping. And number two, if you've got the dough or the HSA and you want to give it a shot, I tried it and I liked it. I liked it a lot, and I put it on several of my patients and several of my celebrities, and they seem to be doing quite well on it. So I would recommend that it's worth checking out. Go to the website, see what it's about. We're going to give one away here at Valley. And also, I want to make sure to thank Valley Sleep, because you guys are awesome. And thank you for having me on. And thank you for doing such wonderful community service by having me do this and giving away one of these treatment devices. These ain't cheap. So thank you so much, Lori.
Oh, you're welcome. So Roxanne, you are the winner. I will email you on how to get your device. And if everybody else is good with questions, we're going to, let's see, Q&A. Yes, it definitely improves your quality of sleep. And what's the initial warranty? That's a great question.
That's
I don't know if
a
I remember
question.
that. I know they're really great about, they've got, you can go on the ebb.com device website and look, but I also dropped in the link for you guys to purchase it. So congratulations again, Roxanne. And Dr. Breus, if you don't have anything else to say, I can let you go. I just really appreciate you doing this.
Of course, Lori, it's my
I'd love
pleasure.
to do a blue light one next.
Absolutely. We'll do one with blue light blocking glasses next. How about that?
Would that be fun? All right.
Absolutely. Sign me up.
Thank you. Thank you, everyone.
Bye, guys.
Have a great night. Bye.